Start. I want to bring us back to our previous discussion of this chart, which I'll hold up for the distance people. Okay, this is the pendulum, and we discussed this when we talked about Freud's early so-called seduction theory, which is really an abuse theory. So it's 1896, he announces that he has found the cause of hysteria, which is the so-called seduction of children. The child is a victim. The adult is perverse. This is a theory of abuse, and it finds the origin of psychopathology in the external world. And then he immediately begins to have doubts, and by the following year, 1897, he's majorly retracting this theory. And people like Jeffrey Mason and Alice Miller are naively saying he had the truth, but he didn't have the courage to stick with the truth because it was such an unpopular theory. Half of the medical people in the audience where he delivers the lecture have hysterical daughters, and Freud is basically calling them perverts, their fathers. And therefore, as a result of his ambition and his lack of courage, these people argue he drops the theory. Now, of course, this is nonsense because he has to drop the theory because, as I pointed out, not all hysterics have been sexually abused, and many people who have been sexually abused do not develop hysteria. So the theory was wrong. He never denied that some of these women had been abused, but certainly as a theory of the cause of hysteria, this is... So then he swings all the way to the opposite, and this is a creative error. Now, all psychopathology has its origins in the inner world of fantasy and desire. And it's the child who's the pervert. Childhood sexuality is polymorphous perverse, incestuous, and this does a lot of damage because women who've been abused are in analysis with a couple of generations of Freudian analysts, and we're trying to talk about what happened to them, and the analyst is skeptical and is saying, my dear, we don't really know what really happened, doesn't matter, it's what you believe happened that matters. She's already confused, and now her analyst is suggesting that this is her imagination or it doesn't matter. And the children are being blamed. Now, so this is a creative error because it puts the concept of psychic reality on the map. The idea of an internal world. The idea of an internal psychic world of fantasy and desire. But Freud realizes pretty quickly that he's gone overboard. And the rest of the development of psychoanalysis is him trying to inch back to a middle position which will do justice to both external and internal. And I mentioned that Bertrand Levine gave us this metaphor of a projection screen which is not translucent like glass or opaque, but some light shows through, and on one side the movie projected on the screen is, say, Gone with the Wind, and on the other side is Casablanca, and what you see on the screen is a crazy mixture of the two. And that's a metaphor for psychic reality, which is always some kind of crazy blend between what came in from the outside and how that gets distorted through fantasy and desire. Okay, so it's in this context that we encounter Ferenczi. Because Ferenczi is one of the first who really begins to recognize and be critical of this excessive swing into the internal world, excessive denial of real elements of trauma, not just abuse, but other forms of trauma in the genesis of psychopathology. So he's trying to bring psychoanalysis back from this one-sidedness back to, he's trying to bring the external world back in. He is probably the first major voice within the psychoanalytic tradition of what nowadays is recognized as relational psychoanalysis. In this little piece by Lewis Aron and Adrian Harris, Bridges, Emigres, and Inheritors, they did a book called The Legacy of Sándor Ferenczi back in 1993. They write that Ferenczi now can take his place as one of the important parental figures in psychoanalysis, of object relations theory, directly in the work of the Balance, Michael and Enid Balint, and passed on to Melanie Klein and Donald Winnicott, of the interpersonalist tradition, carried explicitly through Erich Fromm, and what's Thompson's first name? I forget. Emma? No,
Clara.
that's the actress.
Oh,
Clara Thompson. Clara Thompson.
skip the generation or two.
Yeah, Clara Thompson brought that. She had a big influence on Sullivan. He's a precursor of self-psychology in some ways, of even Lacanian work in some ways, and other European analysts like Joyce McDougall, Chesky Smergel, Andre Green, and in America, Lowald and Ogden. But they say, he was perhaps more accurately mother than father. Rather than being a founding father, he's more like a founding mother, and he brings the mother element in big time. They talk about the impact of Ferenczi on the analytic world in Britain, because the British had to rebuild, and all those kids were taken out of London and settled. And John Bowlby, in 1950, writes Maternal Care and Mental Health for the World Health Organization about the effects of separation. These children are removed from their parents, and we have separation anxiety, and we have loss, and we have mourning being studied. But many of the British analysts were really trying to shift the emphasis from the patriarchal father to the mother. Fairbairn, Klein, Winnicott. Juliet Mitchell noted that the political and social climate of post-war Britain was one in which the restoration of family structure, and particularly the crucial role of mothering, was a high priority. Winnicott is a critical figure here, as is Bowlby. And Ferenczi's focus on the familial and maternal environment and the disruptive power of trauma were particularly compatible with the social needs of post-war Britain. So he has a big impact on British object relations theory. He was Melanie Klein's first analyst in Budapest. She then goes to Berlin, where she's analyzed by a much more Freudian character, Carl Abraham. But Ferenczi's influence, well, Abraham influenced her majorly, but so did Ferenczi. Ferenczi's ideas about play, mothering, and the need for maternality in psychoanalysis. They quote Ferenczi, 1932, "I admitted that we men, even the best doctors among us, are not good at taking care of children and the sick. From childhood, men are taught by their environment and by other boys not to show sentimentality, which is regarded as womanish and childish," unquote. There, Suttie is echoing the Scottish psychotherapist Ian Suttie, who, in a much neglected book for a long time, The Origins of Love and Hate, published in the mid-1930s, he wrote of our whole Western civilization suffering from a taboo on tenderness. And Ferenczi's trying to get at the same thing. The reason Suttie's book was so neglected was that he was not formally analytically trained. He was at the Tavistock. But the real reason it was neglected was because the same reason Fairbairn's work was neglected. Fairbairn was up there in Edinburgh, and Fairbairn's work was less neglected than Sutti's, but both of them wrote very clearly, and they didn't pull any punches. When they disagreed with Freud, they said so. And they said it clearly. They weren't pulling their punches. I compare them to Erik Erikson in America. Erikson offers really, it's a profound critique of Freud. Erikson has a radically different understanding of the mind than Freud does. But you hardly know this by reading him. He's so damn polite. He's soft pedaling it. He's almost hiding his departures from orthodoxy. Well, I mean, he was trained by Anna Freud, and when we come to him, we'll study some of the biographical reasons why he would play down his differences. He was in terrible need of community, and he couldn't risk offending. But both Fairbairn and Suttie and Ferenczi, they were healthier characters. They didn't have to downplay their disagreements. They weren't disparaging. I mean, Ferenczi was a great admirer of Freud, but they kind of wanted to call a spade, and they proceeded to do so, and that got them in big trouble with IPA orthodoxy. And one of the main techniques of the ideological IPA apparatchiks is the silent treatment. They won't even do you the honor of debating with you to point out what they consider to be the errors of your ways. They just ignore you. The silent treatment is a very powerful, and they gave the silent treatment to Fairbairn for a long time, and for decades they gave the silent treatment to Ian Suttie. Not so much to Ferenczi, because Ferenczi, was right there in the middle until towards the end he really began to depart from Freud, and then he died. But Ernest Jones blackened Ferenczi's name. Ernest Jones implied that Ferenczi was psychotic, and he was not psychotic. He was sick. He was ill, but he wasn't psychotic. I mean, that's quite the slur, and that's. Of course, that's been fairly common in the analytic community to suggest that people who hold views you disagree with are because they're insufficiently analyzed, or they had a bad analysis, or they had an analysis with the wrong person. It's a way of really calling their psychic health into question. It's pretty ugly, really. The other thing about Ferenczi was that he was a political progressive. He was a leftist. And there have been a few, Otto Fenichel, Erich Fromm, but Ferenczi's progressive ideas didn't sit well with a pretty conservative bourgeois Freud. It amuses me how these days, a lot of people are trying to make a case that Freud was at least a left liberal, if not something like a social democrat, because he did have some sympathy for the poor, because he had been poor as a boy. He was sympathetic to the idea of some income distribution, because he thought that the working classes were more deprived than they needed to be, and were more sexually frustrated than they needed to be. And so, he was in favor of some income distribution, but in many ways he was a profoundly conservative and reactionary thinker, especially the older he got. The older he got, the more he saw the unconscious as a threat, barbarous. I mean, the early Freud described the primary process as orderly, and he proceeded to describe its laws, condensation, displacement, and so on. And so you could well imagine an artist wanting to dip into the primary process in order to, as part of a creative process. But in 1923, Freud is calling the id a chaos, a cauldron of seething excitations. snakes, insects, cauldron, witch's brew. And he's seeing the superego as a bulwark against barbarism. And a lot of people haven't appreciated, I don't think, that Freud's 1921 book, Group Psychology and the Analysis of the Ego, can also be seen as a really reactionary work. He's very afraid of groups, because groups make revolutions, like they did in 1917, and like they did in whatever was the year of the French Revolution. What's that? 1789. So groups, that's a contribution to mob psychology, and he's depicting the mob as unruly, primitive. He joins Gustave Le Bon and Gabriel Tarde and a whole bunch of writers around that time. They were not exactly Democrats. Freud was not a Democrat. Freud thought that the working class was lazy, stupid, and oversexed. He was not when he visited America, he wrote in one of his letters, America is a great mistake.
Well, we would all agree
And now
with
we
that,
know.
right?
I think what he had in
Quite prescient.
Yeah, well, I
You just didn't like Herbert Hoover.
I think he didn't like American democracy. What we're talking about is the deterioration of American democracy. We're talking about the failure of American democracy. The idea was pretty good, balancing powers, because you don't want anyone to have all the power, because, who should get the power? Nobody should get the power, because power corrupts absolutely, and so on. It was a great idea. It hasn't worked out so well. But anyway, he didn't even like the idea, because he grew up in the Austro-Hungarian Empire under Emperor Franz Joseph, the Habsburgs. He only knew authoritarian monarchy. The idea of giving all of this power to the ordinary people was something that didn't make very much sense to him. He really liked Mussolini.
Question?
Yeah.
Sorry,
Here.
sure.
Let me just finish that thought. I don't want to leave the wrong impression. He liked Mussolini until Mussolini turned on the Jews. Then he didn't like Mussolini anymore. But at first, he thought Mussolini, the great leader, was going to reconstruct Europe and was going to organize what needed to be organized. Anyway, go ahead.
But I wonder if Freud also sensed that the masses preferred authority. That the masses, while they could create revolutions, they could also create very violent revolutions. And they could opt for more violent regimes. We were talking a little bit about 30s and
Right.
the move toward National Socialism. And
Right.
sometimes when you read his descriptions of groups, you get that sense of this has to do with his understanding of human nature, as a very dark and violent
Right.
thing.
Yeah, well, absolutely. He had a sense of how people, not just the working classes, but the masses, people, as did Erich Fromm. Erich Fromm's first book is Escape from Freedom, Fear of Freedom. And it's about totalitarianism. It's about Nazism and Stalinist communism. But when you're reading Fromm, you're not reading Freud. Fromm has a sense of how people, out of their fear of freedom, can surrender their freedom to a dictator. And he certainly is a critic of totalitarianism, but he's a radical Democrat. He's not despairing about people. He thinks that people can overcome that, and that people can grow up, and that people can learn to live with their freedom and can create. Well, he was a social democrat. Maybe he was a little further left than a social democrat. He was a Marxist, okay, but a democratic Marxist is what Fromm was. I don't know. I know. I hear what you're saying. One can read Freud that way. He's writing that book, Group Psychology, in the 1920s, and it's 10 years before the Nazis are starting to march in the streets, and you can almost feel it.
There's also the Russian Revolution.
The Russian Revolution had just happened and had turned savage, and revolutions can turn savage. You know, on that subject. I mean, I'm not a revolutionary Marxist. What turned me away from revolutionary Marxism was reading the great trilogy, The Prophet Armed, The Prophet Disarmed, and The Prophet, forget the title, but this is Isaac Deutscher's great, some people consider it the greatest biography written in the English language, of Leon Trotsky. And Deutscher had been a Trotskyist, but in the course of writing this biography, it turns you away from revolutionary politics, because Deutscher has just such a profound sense of how revolutions can go so wrong and are almost destined to go wrong and produce a new tyranny, you know. He's not a reactionary thinker, Deutscher. He's not a conservative in any sense of the, but he's certainly turned from Bolshevist to Menshevik, right? I mean, there's Deutscher, there's no doubt about that. Yeah, so you can read Freud that way, but yeah, you put those comments together with other things he says about working class people being lazy, stupid, and oversexed, and his changed view of the unconscious. Not enough has been made in Freud scholarship of the radical change in Freud's view of the unconscious mind. You know? Not something that you can draw order from, but a terrible chaos that threatens, unless you have leaders and police and so on, you know. It's a very dark, it's too dark a view of human nature. It's way too dark a view of human nature. And conservatives always have that view of human nature. That's what conservatism is. You know, the civilization is a thin veneer. Don't go tampering. We admit that existing social arrangements are imperfect, but don't tamper with them, because the barbarians are at the door, and we're likely to get something worse, say the conservatives. Man, I don't like that way of thinking. How are we going to get anything better if we think that way, you know? Anyway, we got to come back to Ferenczi. Okay, some things to know about Ferenczi. So he's born in Miskolc, spends most of his life in Budapest. So Freud is born in 1856 and dies in 1939. Ferenczi is born in 1873 and dies in 1933. He dies 6 years before Freud at the age of 59. He's 17 years younger than Freud. So a generation younger than Freud. He's a Hungarian. He's not a Viennese. And that's huge, because these are very different cultures.
I'm sorry, I read that he was actually from Polish.
Miskolc is Polish, I think,
Right.
yes, and he moved to Budapest.
So, and you know within the hierarchy amongst Jews that the Viennese look down
On the Polish.
very much so.
Yeah,
I mean,
yeah.
I'm Russian and my father looked down on
Right.
very much Polish Jews.
Right.
So I can't imagine that wasn't a factor. on
I'm
some
sure it
level.
probably was a factor. But also the fact that he became Hungarian. I mean, he had Polish origins, but he grew up and worked in Hungary, and Hungarian culture is quite different from Viennese culture. So there's the Polish angle,
But
and
the
then there's the
Viennese were
Hungarian.
always considered like the elite.
Yes,
'Cause-
yes, but an elite, but also a very different style. Ferenczi was highly emotional. He was warm. Freud was very intellectual and very aloof. You know, he was an aloof Viennese intellectual, kind of remote, whereas Ferenczi was this much more down-to-earth, emotional kind of guy. He really was interested in curing people. Someone says he could have cured a horse. he just was a kind of a therapeutic personality. Freud wasn't. Freud wasn't interested in curing. Freud never wanted to go to medical school. He was forced into it. Freud wanted to understand. He didn't want to cure. He had that scientific frame of mind. He wanted to understand what was behind the symptoms. He didn't want to just make the symptoms go away. That's why he abandoned hypnosis. One reason, you know. What's behind the symptom? Insight. Ferenczi, in his approach to therapy, wants to mother patients and father patients. He sees two different styles of doing therapy. Therapy as mothering, therapy as fathering. And he sees two different ways of inducing hypnosis. You can induce trance in the authoritarian father way, and you can induce trance by being the soothing, coaxing, soft mother. Two different ways of inducing trance, two different ways of conducting analysis. And he wanted to do both, and I think he's absolutely right about that, because long before I knew that Ferenczi was saying this, I always felt that, you know, some beginning therapists that I supervise, some of them are like way too, what would be seen as, I don't want to get into gender stereotyping here, okay? These are arbitrary. There's no reason why we have to call this one style mothering and this other style fathering, but we're stuck with this gender talk to some degree. But some therapists, and they're often women, they're way too mothering. They're all about empathy and compassion and understanding and so on, but they're really lousy at confronting. They're really lousy at establishing boundaries. And they're lousy at stirring the pot. I swear to God, there's been an excessive emphasis in that direction in recent years in psychoanalysis. You hardly ever hear in clinical seminars anyone talking about how the therapist needs to stir the pot, how the therapist needs to be a provocateur, how the therapist needs to provoke the patient. How often do you hear that? Not very often, but patients do need to be provoked. The pot does need to be stirred. And boundaries do have to be set. And sometimes the therapist has to confront, sometimes bluntly. But then there are all of these guys who as beginning therapists, have the absolute opposite problem, which was my problem when I started out. Because my dad was a surgeon, and I identified with him. And I thought I was becoming something like a psychosurgeon. I was going to make incisive, and being a male, of course, I thought I was going to give penetrating interpretations. And, you know, the women to whom I was giving penetrating interpretations were going to go, Eureka! And their problems were going to be solved. You know, so I had real trouble with this at the beginning, because I was way too...
Did anyone tell you that you were a total narcissist?
Phallic. Phallic more than narcissist.
Well, they're not mutually exclusive.
They're not mutually exclusive. No, not at all. No, here's how they cured me. One supervisor started to spin the first metaphor that he spun was the old family doctor who really doesn't have any drugs. There's no sulfa drugs. There's no penicillin. So all you can do is sit by the bedside and mop the patient's brow and hope that the fever breaks and the patient is still alive in the morning. That's about all you can do. So he's telling me, stop being so active and penetrating and just, you know, be with the patient, you know. And that didn't work, so then he started spinning the metaphor of obstetrician. You know, like, you're just like an obstetrician, you're just assisting at a birth. But that didn't work either, because obstetricians sometimes use forceps. Then he finally got to the metaphor of a midwife. And that got to me, because that suggested that I had to make some kind of a gender switch of some kind. I had to, you know, midwife. Yeah, how am I going to accomplish this? I have to turn into a midwife. And then another supervisor said, Professor Carveth, don't just do something, sit there. and eventually, I kind of got it. But it's interesting. People they bring one or the other of these biases to the therapeutic process, and they need to be able to do both. And Ferenczi got that. A lot of the Viennese Freudian analysts were very intellectual, very aloof, very silent, very passive, not active. I mean, Ferenczi experimented with technique. That's one of the great things about Ferenczi. He was willing to experiment. And he experimented with both active and passive technique. Both the indulgent mother and the stern father.
Was he in analysis with Freud ever?
He was more or less, they had conversations. I don't know whether they would have called it a formal analysis. I mean, in those days, in the early days, an analysis might have lasted a couple of weeks, and it might have been a matter of walking around through the Prater with Freud and discussing some dreams. Freud refused to be in analysis with Ferenczi. He refused to open up to Ferenczi in significant ways because he thought it would undermine his authority. Well, it would have. And he was very concerned to preserve his authority. I mean, he was a very hierarchical character, and he organized the psychoanalytic movement along very hierarchical, patriarchal lines, from which we're still suffering. I learned from a New York analyst a couple of years ago, he actually published this paper, Arnie Richards. I didn't know, but many of the leading figures of the New York psychoanalytic Freudian establishment were ex-Marxist-Leninists. They were card-carrying members of the CPUSA, the Communist Party of the USA. Charles Brenner was a commie. Jacob Arlo was a commie. Ralph Greenson was a commie. Greenson had this slightly older woman who was his housekeeper, and she was a central member of his cell, his communist cell. They dropped all of this, of course, in the 1950s with McCarthyism and everything. They did their best to keep it secret. But why is it important? They were very authoritarian because Leninists are. Leninists want no part of democracy. They're the most manipulative people. They are a small elite, and they maintain a hierarchy, and they want to control everything from the top down. And they fit beautifully with the International Psychoanalytical Association. Freud had secret rings that he handed out to his secret committee. And the secret committee, Jones and Abraham and Eitengon, and so they were all to control the doctrine so that there would be no departures from the official ideology. They were operating exactly the way Leninists operated. So no wonder these guys felt at home in the ITA. Yeah.
Well, then maybe that's why he hates philosophers so much. I mean, you were saying that earlier you had this quotation, I think it was what Freud was saying about religion and how philosophers, they take words and then they change the meaning of the words so that the origin of those words no longer stays with us.
Right.
You had a killing of God, this kind of like a replacement of God, this kind of thing. And it seems to me that reading this book, I can't get straight anymore what any of these words mean because everybody's got, all the way from Freud all the way through, everybody's got a different definition of what this word means.
Yeah. That's part of the problem.
It's a big problem, and it's almost as if he had some sort of premonition about what was going to happen to him as kind of a religious leader in a certain sense.
Oh yes, definitely.
And so, I mean, if he would really hate philosophers, that would make sense because this is a book about the history of a philosophy. It's not
Sure.
it's not science. So it's.
I think there are scientific elements.
I'm
We
not
could get
saying
into a
there's not
definition of
scientific
science,
element,
but
you
yeah,
know what I mean.
Yeah, I
right?
know what you
and
mean.
so
Yeah,
it seems to me that it's completely consistent with what you were just saying right there. That this is it's all very consistent. He's got this. He's almost like a cult leader. He's got his
Yes.
secret meanings. It's.
Yes, he has his ideology. He's very concerned that heretics are going to depart from
Yeah.
it, and the whole history of the psychoanalytic movement is it's a history of heresies. Jung, Adler, Rank, Ferenczi.
Klein,
I mean, look, even Klein. The greatest minds in psychoanalysis have been thrown out of the psychoanalytic movement. Jacques Lacan, Eric Fromm. It's dangerous to be a great mind in psychoanalysis. It's like that statement that always really
The
haunted me.
communists like that too.
Oh, absolutely! Of course, that's the history of Marxism. That's the history of communism. Of course. Look what happened to Trotsky. He got an ice pick in the back of his head. So, yeah, exactly. It is a movement, and the statement that always gives me the chills is someone says, how can you consider yourself a good Christian when you haven't yet been crucified? It's kind of like a job requirement if you're going to be a Christian. You got to get your leader. Not much of a Christian if you're not getting crucified. Anyway, you're right. I mean, the history of psychoanalysis, it's the history of an ideology. And
I didn't mean to derail, but you were talking about the secret society essentially. I just
yeah.
trying to keep it in anymore.
No. Well, I mean, I think you're quite right. I think that's exactly characteristic. It's and Freud is very concerned to maintain the purity of the doctrine, which is not a very scientific attitude. Although I don't want to idealize science. I mean, let's face it. Most modern philosophers of science will tell you that science is far more cult-like and far more political than any naive notions of the purity of scientific progress would hold. So maybe there's not such a radical difference after all. I mean, movements of thought tend to take on this characteristic. Yeah. Okay. Well, we've talked about his experiments. Most analysts were not being experimental. They were taking, a standard official technique and adhering to it, often really rigidly, sometimes to an absurd degree. Okay. So he's zeroing in, so he has a desire to cure, Freud has the desire to know. He's talking about the resistances. He's having insight into the resistances that can attach to the rules. The rule of free association, the rule of free-floating attention. He's observing how the rules themselves can be put to the service of resistances to the analysis. And it recently just occurred to me that, the analysis for Freud is supposed to start with the enunciation of a rule. What he called the basic rule. Say everything. Patient is instructed to follow the basic rule. Whatever comes to mind. Don't hold anything back, don't censor, no matter how embarrassing, whatever. Say everything. That's the basic rule. Well, that starts with the superego. That's a rule. Rules belong to the... So I don't do that anymore. I don't announce the basic rule. I invite the patient to make use of their free speech. I don't tell them, I just invite them. This is confidential, and I invite you to exercise your free speech. That's an invitation. That's not the laying down of a basic rule. you know. So Ferenczi is zeroing in on these kinds of things.
Was Ferenczi, at one point I heard that Ferenczi was just a scribe for Freud. I
A
gather
scribe of Freud?
Yeah, essentially, he wrote the doctrine.
Freud wrote the doctrine.
No, Ferenczi
Ferenczi.
helped perpetuate the Freudian doctrine.
Well, he was
That
part of
changed.
Freud's secret committee. He was very close to Freud. He was one of Freud's closest disciples, but over time he started being far more than that. He started experimenting. He started deviating. He started thinking freely. He started questioning orthodoxy. And of course the big thing he questioned was Freud's swing away from the trauma theory, and he begins to realize that many more patients have truly been traumatized and have been sexually abused, and real violence is being done to them by analysts who aren't hearing about the abuse. So no, I mean, far more than that. He was a very creative analyst,
Did he
and
have
it got
any-
him into trouble.
Did he have any influence on Freud later on in life?
Was it reciprocal? I think probably not that much. What did Ferenczi contribute? I mean, Freud didn't object to all of Ferenczi's work. Some of Ferenczi's work in the early days was quite orthodox. I mean, it was sort of small elaborations of the master's ideas. But over time, it starts becoming more and more creative. So, I mean, I think the work that Ferenczi produced that was Freudian, Freud was going to accept. But I don't know that it had a big impact on Freud. I don't think Ferenczi changed Freud's mind about anything, really.
Ferenczi read The Confusion of Tongues before he delivered it, and Freud begged him not to present it.
To present it. Yeah, begged him not to present it. Right.
Are you going to go any further into his experimental techniques?
Well, just to say that he experimented even with mutual analysis.
Yeah.
He went so far as to having the patient analyze him,
Yeah.
which I think is going a bit too far myself. But it's an indication of how experimental he was. I don't know whether he actually took the position on the couch and put the patient in the chair. I don't think it was quite like that, but you know, he would tell patients his dreams, and he would talk to the patient about his problems, which I'm a bit mainstream in that, and that I don't think that's a particularly good idea. I mean, I think when we make a mistake and the patient calls us on something, we need to acknowledge the mistake and be honest about it, but I don't think we need to talk about the origins of our mistake in our troubled relationships with our mothers. I mean, that's taking up the patient's time. They're paying for their therapy, and I'm filling their therapy with discussion of my mother problems. I don't think that's particularly helpful. So I think he went overboard. I mean, it has to be said that, I mean, he was very experimental, but he was kind of an unstable guy. You know, I think he had mood swings. I think there was a fair amount of splitting. And he would zigzag. He would zigzag between being the stern father and being the indulgent mother. So, yeah, he wasn't the most stable character in the world, but he discovered a lot of interesting things as a result of that very creativity, that very flexibility, you know.
Have you got examples of what he calls active technique?
I don't think I have any concrete examples of it, other than that he would confront, he would engage the patient. He would call it direct attention to defenses in a way that a more traditional analyst would not. He would stir the pot. He would be provocative in various ways. I don't think he played roles particularly. I don't think it was a matter of him trying to assume the role that he figured the patient needed. Alexander and French, in their sort of ideas of corrective emotional experience, they were influenced by Ferenczi, but they took it in a direction I don't think Ferenczi took it in. I mean, you know, he wasn't saying to himself, the patient needs the stern father, so I'm now going to play the role of stern father. I don't believe he was doing that. My sense of it is just that he was joining in a conversation. That's what he means by active technique. You see, by active he means not passive like the Freudians, who are sitting back silently, hardly saying anything, and in some sessions saying nothing whatsoever, sometimes for weeks on end. I mean, I've heard reports of some Freudian analyses where, I mean, you know, the analyst rarely said anything. That's passive. So I think, you know, active for Ferenczi means engaging in a dialogue and an ongoing conversation with the patient.
He admits in further contributions with a patient that had to pee so often they couldn't carry on, he just absolutely forbid him to pee for 2 hours.
Yes.
And then said, see, you can do it, you're cured.
Well,
And he
that's-
was.
Yeah, okay, so that's one side of Ferenczi's experiment. So there he's being the stern, forbidding father. Okay? But then later he will decide, no, we need to experiment with being the soothing, coaxing, permissive mother. And he will go very far with that too. So therefore he looks very unstable, especially from the standpoint of the very reserved, aloof Freudian. I mean, Ferenczi looks like he's all over the map. Yeah.
Given that he was Melanie Klein's psychoanalyst,
Right.
is there some origin there of the paranoid schizoid? Or if she were to take his technique and be reductive, would you get to the paranoid schizoid
I think the
issue?
paranoid schizoid comes more from her experience with Karl Abraham. Karl Abraham is the one...
Did I misunderstand that? Like, does that make... am I
Well, because,
tracking?
see, the paranoid schizoid position for Klein, as we'll see when we come to Klein, is it's all about splitting. Okay? Everything is divided into all good and all bad. And in the paranoid schizoid position, there's no one mother. There's an all good breast and there's an all bad breast. And Abraham is the guy who put the bad mother on the map. You see, there is no bad mother in Freud, except little glimmers of that phallic Medusa figure. But generally speaking, in mainstream Freudian theory, there's very little echo of the mother at all, and certainly very little echo of the bad mother. Partly because Freud was busy repressing his hatred. Well, here's this stupid thing Freud says. Where does he say it? I'll track it down. But he says all relationships, human relationships that reach any depth whatsoever, he says, are characterized by ambivalence, a mixture of love and hate. Except, he says, for the relationship of a mother and a son.
Except that one.
Except that one. You know? So why could he not go there? He couldn't face the idea that he himself could harbor both love and hate for his mother. You see? He couldn't go there. Abraham went there. And Abraham went there in a very interesting way through Abraham's studies of the paintings of an Italian painter called Segantini, who painted all of these paintings with titles like The Wicked Mothers, and these mothers are hanging by their hair from trees, they're being punished, I mean, Segantini had major hostility towards his mother. I think his mother abandoned him, died, I forget the story, but there's a wonderful paper by Ulrika May all about Abraham's discovery of the bad mother. So Abraham put the bad mother on the map, and Abraham then was aware of the splitting, and that's where Klein got her start,
I
really.
was only thinking because you were sort of saying it was a bit manic, you know, one way he was very nice and the other way he was super.
Oh, that's a
super
different
sort of-
question. I thought you were saying, did he contribute to the theory of the paranoid schizoid
No,
position?
no,
Did
I
he
meant-
live in the paranoid schizoid
That's
position?
what I was he setting some sort of
Well,
precedent?
he lived. Yeah, you could say, like
I mean,
by
she was looking up to him, and he was going
And
all
he
the
was
way
kind of-
good and then all the way bad.
yeah.
That's what I was
Well,
trying
whether
to point out.
whether that led her to the formulation, I don't think so. I don't think, but she had an experience of Ferenczi. I mean, a lot of people would look at Ferenczi and they would diagnose him as borderline nowadays. I don't know whether I'd go that far, but he was a little bipolar.
I was gonna say, is that not confusing to a patient? Like to be
Totally.
Of course.
one way and okay.
Of course, but is
Experiment.
it not confusing to a patient to walk into your Freudian analyst who sits there like a wooden Indian and never says anything for 5 years?
Yeah.
I mean, which is crazier?
I-
Frankly, I like the guy who swings
Yeah,
more
no.
than the wooden Indian.
No,
guy.
I
day
mean,
is
I would
interesting.
say it would be confusing, but I mean, I don't have comparison,
No,
so
no,
I
totally.
don't know.
I wanted to talk specifically about confusion of tongues, which is his probably best known paper. Confusion of tongues between the adult and the child. This is the child speaking the language of tenderness, the adult speaking the language of passion. So he's trying to move the pendulum that Freud allowed to swing way too far away from the environment. He's trying to bring it back towards reality, and he's trying to acknowledge the reality of sexual abuse. And of course this gets him into big trouble with the Freudian establishment. But here's what he finds, and this is his brilliance as an analyst. You're supposed to, I mean, the Freudian analyst, you're supposed to put everything into words, so he's encouraging his patients to relive their traumas in the therapy, to put their traumatic experiences into words. But he's finding this often makes them worse rather than better. It's supposed to be a talking cure. With severely traumatized people, forcing them to talk about the trauma frequently makes them worse. And they will tell you, and they told him, don't you understand that when you make me talk about it, when I leave here, I can't go back to work. I have to go home to bed for 3 days. You know, this therapy is destroying me. You're re-traumatizing me by making me talk about this. And Ferenczi at first thinks this is resistance, which is what a Freudian would think. But the patients are calling him insensitive, they're calling him cold, they're calling him cruel, they're calling him conceited. But having called him all these names, they end up complying. They end up burying their rage. And Ferenczi is gradually becoming aware that the patients have this acute sensitivity. They're picking up on the analyst's wishes, whims, sympathies, antipathies. They're reading the analyst. Now, you know, Freud talks about how patients betray themselves. There's that wonderful passage, he who has eyes to see and ears to hear may convince himself, Freud writes, that no mortal can keep a secret. If his lips are silent, he chatters with his fingertips. Betrayal oozes out of him at every pore. I think that's in the Dora case. Okay, so human beings are constantly the return of the repressed, right? We leak. We're trying to hide it, but we leak. Freud is describing patients. Somehow analysts are supposed to not leak. Well, if people leak, so do analysts leak. If analysts read their patients unconscious, so do patients read the analysts unconscious. Okay? And Ferenczi is getting this. He's realizing that these patients are reading him, but instead of accusing him of errors and blindness, they comply. They comply. They don't allow themselves really to criticize beyond a certain point. and Ferenczi is beginning to listen to their criticisms, and he's beginning to think that they're right. This is not just resistance. He is being cruel. He is being insensitive. Because in getting them to talk about their trauma, he's completely destabilizing them. So he's really listening to the patient in a new way, and not just dismissing it as resistance. So he's saying, you know, we must discern the painful events of the past, and we need to discern the patient's repressed or suppressed criticism of us. Patients often won't let themselves speak their criticism of us, and it leaks out, and we need to be sensitive to hearing that. There's the concept of identification with the aggressor. We mostly associate that with Anna Freud's idea of identification with the aggressor, but Ferenczi's got a completely different definition, and here's an example of words being used in opposite, and we have to sort it out. What does Anna Freud mean by identification with the aggressor? She means, well, her example is a couple take their child with them to a dinner party at some friends, and the child gets sleepy, so they put her to bed upstairs, and then they hear some noises, and they go to the bottom of the staircase, and they hear boo, boo, and they go up and they ask her what's going on, and she says she's scaring away ghosts. So that's identification with the aggressor. She's being a ghost in order to scare ghosts away. Some of the inmates in the death camps formed an identification with the most sadistic guards and became their assistants. Stockholm syndrome. Okay, we're talking about the abused child becoming an abuser. That's Anna Freud's sense of identification with the aggressor. That's not what Ferenczi means by identification with the aggressor. What he means is that the abused child doesn't become like the abuser, but simply becomes hyper-acutely able to read the abuser and to give the abuser what he wants quickly, to know what he wants and how to give it to him, because if you don't, he might kill you. Okay, so you become like, the abused child becomes like a little psychiatrist, empathically attuned into the personality of the abuser, to know exactly what he wants, so as to quickly give it to him, so he doesn't fly into a rage and possibly kill you. That's a very
Like
different.
an appeasement?
It's appeasing him, reading him and appeasing him, reading him and complying with him, and he realizes that's what his patients are doing with him. They're reading him and complying with him, instead of verbally criticizing him. Okay, that's quite a creative insight he's having here. He's listening in a completely different way. He's listening to very unpleasant things, and he's thinking, wait a minute, maybe I am torturing them. Maybe I am being cruel. And then he's observing how they drop it. They drop the criticism and start complying with him. Right? The other, so he says we need to help our patients speak their criticism so that they don't bottle it up and turn it on themselves. We need to help free up their aggression so that they can speak their criticism of us so it doesn't get turned on them. This turning of their aggression on them, that's the superego. Okay? Ferenczi is aware that to the extent that the patient bottles up the aggression, it's going to get turned on them, and it's going to be taken over by their harsh superego, and now they're going to be depressed or masochistic or self-attacking. They won't attack us, they will become self-attacking. And then he goes he says these negative feelings that the patient's having, he's not dismissing this as merely negative transference. Freudian would hear this as negative transference. Ferenczi's not hearing it as just negative transference. He's saying what's happening in when the patient voices all of this negativity, what's happening contrasts markedly with what they went through in childhood. In childhood, they weren't able to speak their negativity at all. So the fact that they're now doing a whole critique of you as the therapist is a whole new thing happening here. They couldn't dare voice their criticism towards their parents, but now they're voicing it towards the analyst. This is something valuable. This is not to be dismissed as negative transference. This is a breakthrough in authenticity, right? Of course, Ferenczi's criticism of Freud was that Freud never really analyzed Ferenczi's negative transference. Yeah.
I can't ask my question quite clearly, but it was in that point, I can't formulate it, but in this section where he was talking about the child becoming the psychiatrist and identifying with the aggressor,
Right.
he went on to discuss how, I don't know if you could just read the next few lines, but it was something about how the child copes with the whole experience. I remember I highlighted it, but I forgot.
Well, I wonder,
Thank you.
can you read the passage?
Yeah, you put a few marks on yours.
Tell you what, sort that
I'll
out,
bring it
and
next
we're gonna start next week, because we're not gonna finish Ferenczi
Okay,
tonight, so
okay,
we're gonna
I'll bring
start.
that
So
question
bring
next
that
week.
at the beginning next
Thank
time.
you.
Let me just finish up by saying that, here's another whole theme that he develops. In situations of child abuse, the child introjects the abuser's guilt feelings.
That's getting to it.
After being attacked, the child feels both innocent and guilty. The child feels ashamed. And he doesn't any longer have any confidence in his own senses. The abuser, out of his own guilt for abusing, he blames and reproaches the child. So imagine a man abusing a little girl and then calling her a little slut. And a part of her takes this on, that she somehow is responsible for, that she's the guilty party for making Daddy do what he did. She takes on his guilt. Now, Freud has this concept of borrowed guilt. Guilt that I suffer from that really doesn't belong to me. It's guilt that someone, like my father or my mother, found unbearable because of their narcissism. And so they put it onto me. And as a child, I'm now burdened by the guilt that really is my father's or my mother's. This is borrowed guilt. Someone I supervise made a brilliant breakthrough a few years ago. We were talking about this concept of borrowed guilt, and she said the Freudians, they should never have called it that, because it's not borrowed, because the people who donate it don't want it back. Kind of obvious, isn't it? I mean, why call it borrowed? I mean, the child doesn't ask to borrow it, and the person who gave it doesn't want it back. What kind of euphemism is this? Borrowed guilt. This is projected guilt. This is the parent is using projective identification or emotional induction to park feelings in the child that the adult won't have. So he will not feel the guilt for the abuse. He makes the child carry it. This is induced guilt. The child introjects the abuser's shame, and the child feels ashamed and feels guilty.